everyone. Thank you so much for having me. My name is Yen Azzaro. I'm coming to you from Ypsilanti, Michigan, and I'm so excited to be here today. I've been a graphic recorder this month for 15 years, pretty much most of the time. Has anybody ever seen a graphic recorder? Okay. Well, my hope today is to impart a form of graphic recording called sketch notes with you. So, this is a very personal practice. I'm not asking you to prescribe to anything that I do, but I am hoping that I can impart one, two, or maybe three skills or techniques that you haven't done before. And it will help you to study, listen, retain just a little bit more. Um, how many of you took notes as students or currently as a forever student? How many of you use and revisit your notes? How do you go about using your notes? I would just love to hear how you utilize your notes, how you best utilize them. Feel free to shout it out. Yeah.
So I can't do the fancy stuff that you do. I can't do the fancy stuff that you do, but I remember when I was in elementary growing up, I would sketch drawings and I would remember the whole lecture, everything that was said just by looking at my drawing, which was amazing. But
Yes.
I don't do that anymore, which makes me sad. That's why
Uh-huh.
I'm here. So now I just take like bullet point notes.
Okay. Bullets or something. That's more than just writing. That's something. Thank you.
Other thoughts? I know we have some stuff online.
I'm a big note taker, but guilty of not revisiting unless I have to turn it into another piece of work. I go back to them when needed, mostly to help me remember.
Same.
I use just for data as well, especially like when doing like interviews and qualitative research. So I just always go back to my notes as just data and information to like help me understand a little bit more. Yeah.
Mm-hmm. Mm-hmm.
If I don't have a date on it, I'm lost. So
That's right.
so it has to have a date. So that's one thing that has to be there.
Yes, yes, agree, and all of that resonates. Yes. Let's see, someone's hand online, or did that person ask already? Just want to make sure.
For what?
There
Repeat
might have
again?
been a hand up online, but
If you have your hand up online, feel free to unmute and we can hear you here in the center.
Hi,
that's okay.
sorry, I was having trouble getting off mute. It depends on what the notes are for. For instance, there's some courses that I reuse the notes extensively, and then others after the course is over, I may not. So it really depends.
Mhm. Yeah,
Thank you.
context is everything. I don't like to read what's in front of you, but for the sake of accessibility, I think this is a really important quote. It says, "It's long been known that drawing something helps a person remember it," as we were talking about. A new study that drawing is superior to activities such as reading or writing because it forces the person to process information in multiple ways, visually, kinesthetically, and semantically. So of course, we're seeing, if we're able, we have the ability to see what we're writing and drawing kinesthetically because we're attaching a physical movement to it. And then we are also attaching a meaning to it, right? The context in which we're doing this thing. So I've been doing this with, I've been teaching this sketch notes process to high school students and nonprofit adults because we all would like to organize our thoughts a little better. And one of the things that I've said to people is think about your ability and what you can do versus what you can't do. So in front of you are these really nice pens and paper, and I'm going to ask you to take a moment to just clear your mind. And I'm one of those people that needs to have a really annoying, perfect work environment. So I like my drink just so and my pen just so. And I want you to think about the environment in which you take notes, in which you study, in which you take in information. some of you like to write on a pad of paper. Some of you like a felt tip versus a ballpoint. You like a stack of paper versus that single sheet against the hardness of the desk. Dawn is nodding. And if I talk like this, are you able to hear me? I see. Can I, let's see. Can I use a mic that's moving? Okay. All right. Does that work?
Yeah, I'll get you this.
We're going to do warm-up exercises together. And if you online have a moment to grab a piece of paper and your favorite writing instrument, what I'm going to ask you to do is using your non-dominant hand. So if you are right, use your left. If you are left, use your right. If you tell me that you are ambidextrous, pick the one that you are less adept at. And I want you to write down your address. It could be the address of your gym, your favorite restaurant, the bus stop you wait at. Give me an address with your non-dominant hand. Does that work?
Yeah.
Okay, great. Yeah, so take a moment.
Can you hear us online, okay?
Is this loud enough?
Is this loud enough online?
Testing, testing. So you've written that. Now I want you to pretend that the paparazzi's after you, the crowd is after you. Write your signature with your non-dominant hand as quickly and as comfortably as you can. On a sheet of paper, the same paper or a new paper, I'm going to ask that we take 60 seconds, 1 full minute to draw your foot. I want you to think about your foot, doesn't matter which one, inside your shoe, your sandal. I want you to think about the bottom point of your heel. And I want you to trace it inside your mind from the bottom up around the sole, that arch, all the way up until the tip and all the way around. We're going to do this in 60 seconds. And I'm going to tell you when to start. And there's no mess ups. You can't mess this up. I want you to think about what your foot feels like inside your shoe or your sock or whatever it may be. And when you're done, I want you to raise your hand when you think that 60 seconds is up. Okay? I want you to take that full minute to do this exercise. A full minute around your foot. Okay? And you're still using your non-dominant hand. So this should feel as uncomfortable as it possibly should. Okay? So we are going to start in just about 5 seconds. And you can start now. Anyone think it's been a minute yet? Okay, you raised your hand right on the minute mark. So that was quite phenomenal. Now I want you to switch to your dominant hand. I want you to sign your signature as quickly and comfortably as you can. And I want you to describe the difference between the first exercises with your non-dominant hand and describe what it feels like compared to signing with your dominant. What does the discomfort feel like? You don't have to think about it. Confidence. Yes. Ooh, okay. Okay, I like that. That's great. Arm versus hand. Yep. Okay, so I mean, all of these have hit the nail on the head. We are a society that goes like this, and not too long ago, that automation was tied to this. Many of us were writing. And we have become accustomed to an even more automated kind of focus that is so fleeting. And so when you think about your hippocampus in your brain that is for long-term memory, and then your prefrontal cortex that is for like the immediate quick memories, the the drawing that hits your parietal lobe, that's your motor skills, and it works both of those parts of your brain. So you're hitting multiple parts of your brain while you're processing, and that's why this statement is so true.
Sorry, folks online, we're trying to fix it. Thanks for your patience.
Thank you. I also don't mind holding it. Is that better?
Folks online?
Is that better? Testing, hello? Great, thank you for confirming. Thank you for your patience.
Okay. Sorry, Jen.
Testing.
Thank you. Most of us may have seen a newspaper before, but a lot of us read it online. And the really magical thing about the print newspaper is that there was a visual hierarchy. How would you describe a print newspaper? Big headline. Big headline. Subheading, exactly. What else makes a newspaper so organized? Columns, yep. Columns, yeah, sections. Horizontal and vertical. And so what I'm going to ask you to do is pick a subject very simply right now. It could be the sandwich you ate for lunch yesterday, if you remember what that was, because I sure don't. What the rest of your day looks like. Maybe you want to map out what your day looks like. And I'm going to ask you to think about it in a visual hierarchy. And that's exactly what it sounds like. You are going to create things that are heavy at the top and move down. So if mine was if my title was drawing a cat, I might use a couple different methods of making it really, really bold, really, really big. When you are taking notes, sometimes this is not important. Someone said the date was so important for context, right? So maybe that is the most important thing. But if you want to give yourself a visual hierarchy, the most important thing is a bold title Maybe you underline it. Feel free to follow along and do this or do your own. The subtitle. For most of us that take notes, a lot of it is left to right, left to right. And that is where it becomes automatic. If you are already used to writing, left to right is really, really automatic. Okay. So I'm going to ask you if you are willing to break up your space into columns and start to organize vertically. We're so used to the horizontal. If you can start to think about it in blocks or vertical to cause a disruption. Okay. We drew our foots not because that's the favorite part of my body. What I'm looking for is a slight discomfort, a disruption in how you normally do things. So if it's normally like this, I'm asking you if you are willing to draw a box. I'm asking you if you are willing to draw a shape or a shape within another shape to create disruption in your mind so that it's not just a blur as you're going by. Okay. If you can do sections and then subsections within it, that is even better. So you would put your main, you could put your main note here and use arrows to create space within your mind as to where to go next. When you see a block of text, many people kind of zone out. They just see a block of text and they feel overwhelmed. And if you're assigned a lot of reading, that's not a great way to take it in and then regurgitate it. Just taking it left to right is not going to help many people. Okay. So we have shapes. Another thing that is also really helpful for people is within a paragraph or a shape of something, putting a banner around something can make your mind and eyes go there. And a banner does not have to be fancy. It could be a long rectangle. It could be a little bit of a tail behind it, so it emphasizes it more as something important. Did you know that when you have a dotted line, your brain tries to connect it and your eyes immediately go there? Did you know that if you draw an eye looking back at you, you can't not look at it? So these are all weird tools because we look for other things that are human like us. That if something is really important, this could be in your calendar or your date book. It could be the formula that you can't forget. It could be the errand that you must do. Find a way to make it incomplete or weird and uncomfortable and different than what you normally do. It shouldn't take more than a few seconds. So if you need to find that one tool, those two tools, perhaps you introduce color. That's another way that many of us will look at something. Something that is a little bit harder to do, but if you have the time to practice it, is to write differently. I'm not saying we try to go writing with our non-dominant hand, but we get very comfortable writing a certain way. And in order to slow down your thoughts and to slow down the way you take in information, write differently. If you are usually right leaning, maybe you need to lean to the left. If you write very tall, maybe write very slow, short. So think of a way that is opposite than what you are used to in order to elongate the thought in your mind. One of the things that I teach high school students is how to doodle. And you think, well, That's kind of distracting, and maybe it's not great to draw all over your homework. Thank you. But I actually encourage it because so many young people are using online that if they don't remember to check their phone for the stuff they really need to do versus TikTok, they don't do the calendar itself. So I only know this because I have a middle schooler, and he has a date book that he never uses. But I said, what if you doodled it? So what I ask is that I do this for anxiety if I'm traveling or if I'm doing something that feels really strenuous. I actually draw out my day before it happens so that I know what to anticipate it and I have those visuals in my brain and I feel like I know what's happening, what's going to come. So everything is based on a shape. And if you can draw a triangle, if you can draw a circle, a square, or a rectangle, these are not meant to be perfect. They're meant to be a language for yourself because you are your best storyteller for yourself. Okay? So if it makes sense to you, that's great. If I woke up today and I said, I'm going to meet a dear friend for breakfast, I might draw an oval and a half circle and a handle. It's like 2 U's and some steam for the soy latte I had. I'm going to write down 8 a.m. And I can do this in my date book the night before or whenever I make the appointment so that I know not to forget it. You can also draw this in your mind. If you don't have your phone or your date book in front of you, you're more likely to remember that you have a coffee date next Tuesday at 8 a.m. if you draw it in your mind, if you don't have access. Okay? And then I'm coming to UIC. And maybe I write it or I think it in my mind in a way that I would normally not just scribble it in my date book. And I can see a big block UIC in my brain. And I know I want to be here by 9:30. So what you're looking for is to dissect the parts, create objects in your mind. If I sent you to the store and I said, there are 5 things I want you to get, you wrote them down, and then you forgot the list at home, which I do every time. How many things would you remember? If they were related and I said, we're making Alfredo, I need pasta, cream, basil, Parmesan, and a lemon. When you are writing the list, imagine if you could draw a simple circle with those funny little nubs, and that's the lemon. And as you're doing this, you're drawing it, think about what it smells like and feels like when you pierce the lemon skin and it emits that beautiful oil. Sometimes it squirts in your eye and it's so painful. You will not forget to pick up a lemon at the store, right? The smell of the basil. You could draw the basil. The cream is a bunch of rectangles. This is a rhombus with a rectangle. I forgot this part here. The pasta, maybe you draw some squiggly noodles. And the Parmesan. Triangles, squiggly triangles. Maybe some funky circles or dots. And you do this and you think about elongating that memory and the smell and the texture, the crumbliness of the cheese, the pasta. And you're just, rather than scribbling your list, taking an extra 30 seconds to think about what it smells like, what it feels like, and drawing it. Okay. In your calendar book, I showed you that an eye makes a big difference because we naturally gravitate towards human elements. If you can draw a star like this and replace the top with the head, you can draw lots of emotive figures. And these are great because you can add emotion to certain parts of your day or tasks that you need to do. There's excited star. There's tired star. Meditative star. And so all of these human elements that you add to your notes make them more human to you. Okay, we're always looking for that connection. And anything that's jarring or different is what creates emotion for all of us in our notes. Again, more examples of banners, wayfinding, reasons to look, the eyeball. If you created a color legend within your notes, something you take action, something that you need to study, something that's helpful, creating that hierarchy that makes a language of importance for you. It doesn't have to make sense to anybody else at all. So I didn't want to show you my work until the end because I wanted you to have a sense of what your writing language might look like. But I'll show you some examples of work that I've done, and then just give you an idea of how I try to build a visual hierarchy when I'm working. So sometimes it can be through text. Usually I do this in real time and it's for people that are in the room, and I'll do that this afternoon for Dr. Floyd. What I'm looking for is a theme that repeats over and over again, and that can be in really bold text. It can also be for a feeling. If you want to take a feeling away from something, there was a really incredible drummer in the room that was invited, and so I drew the drum. As we're talking about elongating thoughts and making things more deliberate and intentional, this graphic recording was about the Slow Academy, thinking about how to draw ideas out and make them resonate longer and in a more intentional way. This one is for an intermediate school district, and the main ideas are in these circles here. And this one's a really dense graphic recording on climate change. So I thought it would be helpful, and now I'm wondering if I play something with sound on here, will that play for people on Zoom? Okay. So what I would like to ask you to do, if you choose, is listen to a segment for just under 4 minutes about trees, bees, and elephants. And using one, if not more, of the elements that I talked about today. Maybe it's just a banner, maybe it's an arrow, maybe it's using an eyeball, maybe it's splitting up what you hear into sections. But just an exercise to see how you might be able to do something differently. Oh, it's a link. Sorry. Oh, it's on. Oh, that's okay. Here. I'm gonna
up for a second, just to make sure that this.
And this is very leisurely. This is leisurely, so it's a take it as you want to, draw when you want to.
This
write when
message
you
comes from Vital Farms, who works with small American farms to bring you pasture-raised eggs. Click the play button to hear from pasture-raised egg farmer Tanner Pace, who shares the sights and sounds he and his hens experience on the rolling hills of his family farm in southern Missouri.
Back now with Day to Day by cartoon myth, elephants are scared of mice. Now an Oxford University researcher says bees actually provoke pachyderm pandemonium. Lucy King is a zoologist who studied in Africa, in Kenya, trying to keep elephants from trampling farmers' crops. She joins us now from Nairobi. Lucy King, welcome to the program. And whatever made you think that elephants might be scared of bees?
It's interesting. We've been looking at this idea for a few years now, and it all stems from a study which my co-authors Ian Douglas Hamilton and Fritz Vollrath did a few years ago, and they discovered that trees with beehives in were not being damaged by elephants. And of course, it's very hard to get live African bees into the part of elephants, so we decided to record the sound and take the sound to the elephants to see if there was anything there worth studying. And what we saw was incredibly dramatic.
So what you did was record the sounds of these bees and then play them back from loudspeakers near where the elephants were. And what happened?
We actually fitted a wireless speaker into a fake tree trunk that we made, and we managed to get that within about 10 meters of the elephant before driving off and filming from a distance. And when we first played the bee sounds, the elephants stopped immediately what they were doing, turned around to the speaker, and they started turning their heads from side to side with their ears out, their trunks up, trying to smell, trying to work out what was going on, where the sound was coming from. And then one of them would usually trigger a retreat, causing the whole of the herd to either run or walk very fast away in the opposite direction.
We think of elephant hide as being almost impenetrable to anything. How is it that a bee could hurt an elephant?
No, a bee could not sting an elephant through its skin, but having spoken to a lot of local people in our area, they tell us stories of bees being attracted to elephant eyes, and that must be very painful to be stung around the eye. But I think the key thing is that elephants forage up in trees by breaking branches and stripping leaves. And I think this triggers a hive sometimes to be smashed open, and they get bees up their trunk, which must be horrendous. An elephant's going berserk trying to swing their trunk around, trying to get it out.
Well, tell me, what do you think the results of this research might be? These farmers find that their crops are trampled by elephants and they don't like it. They shoot the elephants. So maybe you could surround a crop with speakers, but sooner or later they'd figure out that these were just speakers, not real bees, wouldn't they?
You're absolutely correct there. And I'm doing an experiment right now. I'm just in the middle of it to test that habituation theory, because elephants are highly intelligent, and without a painful stimuli after the bee sound, I think they would very quickly get used to that sound and start to come back. So what our results really are showing us is that it's a way to understand the behavior. And now what we want to do is try and use live beehives around fields of crops to see if it has the same effect as the sound, which we think it will do.
Of course, the problem there is that these bees, they'd be as happy stinging farmers as they would be stinging elephants.
Yes, unfortunately that's true, and believe me, I've been stung a few times, so I know it's really not fun at all. What I've discovered is that elephants generally, they invade people's farms from one direction. So they'll come from a forest reserve or a game park or an area where they feel safe, and they'll come into the shamas from one direction and then leave again. And so we're looking at perhaps just fortifying one side of someone's farm with bees and beehives, and hopefully, the further away from the house and the children, the better.
Lucy King is a zoologist who studied at Oxford University. She's worked at the Samburu Game Reserve in northern Kenya, studying bees and elephants. She speaks with us today from Kenya. Lucy, thank you.
Thank you.
Live from NPR News, I'm Lakshmi Singh. President Trump and his South Korean counterpart have reached a deal on South Korean investments in the United States in exchange for...
Okay. What did you get? What did you capture in image or text? How did you tell yourself the story? Yes.
I drew a speaker with bees coming out of it because I think it's conceptually very funny to play the sound of like recording bees like at elephants to stress them out.
Yes, major part of the story.
Other thoughts?
I had fear as like the big bow thing and a bee on an elephant's like right by the eye.
Yeah.
Yes, 1 second.
I wrote elephant as a big header, then with a big arrow pointing to a stop sign. And the stop sign was connected to a speaker with like bees coming out of it, also using bzz, since that's so common with bees. Then an elephant head confused by the with question mark by the ear. And then I try to draw like a farm. And I think the star person was trying to tell the elephant to stop.
Star person, I love it.
I think we had another hand.
So drew like a farm, like I used what you said earlier, like the arrows, so just like a route to the farm, and then I also drew some trees, and I wrote smell. I don't know why, but I just wrote smell.
Elephant smell.
Anyone online want to share? Feel free to unmute and we can hear you in here. Feel free to also use the chat.
I mean, I think we got it, right? I think we got the gist of it. I'm pretty certain the next time you hear a bee or see an elephant, you might think of this story and tie these things together because you not only heard the story, we talked about it, you drew it, and those connections in your brain are just constantly trying to tie things and connect things together. So, thank you so much for doing this exercise, and thank you so much for listening and participating today. Thank you.
Thank you so much. I know we have some time for questions. So if there's any questions here in person or online while we have Yen, who's going to stick around the rest of the day because we have Dr. Floyd's lecture coming up next after we take a quick break. And if anyone's near campus and wants to run to the library, please feel free to do so. We have so much food here to share with you all. So if you're around, feel free to stop by. But for right now, any questions from anyone online or any of our members here for Yen? Okay, I'm going to start running. 1 second.
Hi, thank you so much for that presentation.
Thanks.
I was wondering, do you ever, when you're drawing and taking notes, have trouble keeping up with the speaker or presenter? And what do you do if they're going faster than you can draw?
Yes. First part is yes, absolutely. I've been doing this for 15 years, and I will tell you at the most embarrassing and devastating moment, I had to do a graphic recording during COVID. This is before I went digital and started doing this on iPad. I was drawing on a large swath of paper on the wall in my studio. I had a laptop stand that had my laptop in it, so my Zoom window was the drawing, and it was the military. And I had successfully graphic recorded for them before. And by successfully, I mean that after an hour, the paper is full and there's content and there's lingo, and they had prepped me for it. And I don't usually get prepped, but if there's a ton of acronyms and a ton of terms that I don't understand, and the biggest barrier to success for my line of work is the rhythm and speed in which you speak. So if you have a fast talker speaking lingo in acronyms, I don't know, I freeze. And so that has happened. Maybe only, I remember that instance very specifically because it was during COVID and because I thought it was like such a big deal to be doing something for a retired naval general. And then in hindsight, that is not the kind of work I enjoy doing. So The best thing that you can do if you are sitting in the middle of a lecture or you're taking in content that you think that you cannot connect with in that moment, take your phone out, record it. There's no shame in doing that because our brains are not prompted to constantly be taking and processing information. So much as we think it is because we're constantly scrolling and swiping and doing these things, we're actually not primed to do that. It's unnatural. So I would say best thing you can do is record it so you can revisit. If that's not an option, open your mind up and only write down words or doodle things that matter to you. If it's like very, very important, if it's content for, I don't know, a test, I feel like there's so many tools and resources that people and especially young people can use now, is to just like give yourself some grace and just revisit and do what you can. Yeah, thanks.
Thank you. And we had a question online asking, I think probably a lot of people aren't illustrators like you and they see your drawing and it looks so good and so crisp and clean. And they're wondering if you can explain it a little bit more, kind of what was your thought process in making your drawing?
Okay, I've had a lot of practice. I've been, other than in the last 15 years, other than doing this and illustrating a lot, I've been a creative director for a nonprofit, and I was a communications manager for a public school district. And so my background has always been in messaging. And my thought is I need to make a person that speaks conversational English or a child understand it. Not because I think that people, can't handle it, but because I have to think about accessibility in a way that reaches the most people most of the time. And I am thinking bare bones. So painful, pointing to the trunk, pointing to the eyes, right? That gets to the B. We get to the sound. I am distilling so like to the most basic, visceral, like immediate gut moment. So I'm just thinking about pain, I'm thinking about sound, and I'm thinking about crops. And that's all I got. And that's about all I can do in 4 minutes, because that's what we're humanly able to do.
Thank you so much. Other questions? One second.
Hi, that was great. So when I was listening to the story, I first started drawing bees, and then it talked about the sound, and then I drew the notes from that. And so my question is like, how do you know when like a thought or a meme is like done to portray that? And like, do you go back and edit? Like, how do you go back and if you're drawing, like, oh, okay, that's the wrong idea, and I'm going to go back and kind of erase or edit that. And then I know there's a big difference between like typing and writing, and I've also learned that like writing in cursive imprints more deep. So what are your thoughts about visual versus like cursive versus writing versus typing in terms of memory?
From the reading that I've done, I understand that drawing is still more effective because of, were you here in the very beginning with the slide about kinesthetic, semantic,
No,
and
sorry, it's
so
parking.
no, that combination of all those things is really the sweet spot. So I did warm up exercises earlier where we wrote with our non-dominant hand and then trace the inside of your foot using your mind. And I said to a group of high schoolers once, what does that feel like? And they said, not having access to your dominant arm is like when you're in a dream and you yell out as loud as you can and nothing comes out. And I was like, Dang, I feel like they nailed it. It's like that feeling of ability is just right on the edge, but you can't quite access it. And I thought that was a really great way to describe it. So if you think about drawing as, for those of us that have the ability to, the full extent of our expression, of thought, of emotive expression, of making a mark when so many of us have not drawn anything. When was the last time somebody drew something before today? Was it in the last week? Last month? Yes. Last year? Or just maybe even longer than that. And so, yeah, my short answer should have been yes. Drawing is the most effective because it combines all of those elements. I've also said to a group of young people before, have you ever had a day where you had like a cramp in your leg or a really bad headache? And you'll remember like a lot of what happened that day because you tied it to something physical or kinesthetic that was happening in your space. And this little kid in the front row raised his hand and he said, I'm having a really rough day today, and I'm going to remember this for a really long time. So, that emotive, that smell, that feeling, all of those are tied to the way that we learn. It's like very much tied to that tactile quality of your favorite pen, that favorite pad of paper you had. It's all tied together.
Another question from online that I received is that people very much admire your work and want to be able to do this, but they're like, I don't have those skills. I don't know where to start. What is a way of that we can be able to start this and make it a part of our daily life, perhaps, to be able to get somewhat closer to where you're at in terms of your abilities?
I'm so happy. This slideshow is open to everybody if there's a way for them to access it. You could also contact
Absolutely.
me directly. I tell students and people, you can contact me anytime. This practice of graphic recording started in the 70s by a man named, I think his name is Ed Sibbets. And it's a consultancy called The Grove out of the Bay Area. And people can go get certified in graphic recording. And you can learn how to do it formally. And I did not go about it that way. I was an art student and just learned how to become an illustrator. So when I'm not traveling for graphic recording, I'm illustrating. And what I would say is if you want to be really good at communicating with yourself, look at textures in nature, look at a pattern on a curtain, read a book that you really want to read, watch that movie, because I don't draw my inspiration only from looking at illustrators. I mean, I do, I love that. But I can sometimes like have a really great dinner with a friend and see patterns in something and like, wow, that would make such a cool texture for a background. So I'd say for people that want to draw more, first of all, just draw more. And then second of all, look at inspiration all around you. It's not just through visual things. It could be something that you hear and you just want to drag your pencil across a piece of paper. That is all your mind learning and experiencing in a new way. And that helps your drawing vocabulary too.
Thank you. I know we're going to stick around a little bit more. We're going to hang out here for the next half hour or so, and then we're going to have Dr. Floyd's presentation where Yen's also going to be doing this live for all of us. I'm going to Boso, that is a way to say hello or a formal type of greeting in Potawatomi. My name is Adriana Black, and I am the founding director of the Odeh Manan Health Equity Center, or Odeh Center for short. This program is being recorded. On behalf of my team, I want to welcome you all to our space, both in person and virtually. Thank you to all who have already been here for the last hour or so for our illustration and graphic recording tutorial with Yen. Yen is still here with us and will be creating a vibrant digital hand-drawn illustration and text with a time-lapse video of our presentation today. As we continue to grow our membership from both within UIC, across Chicago, and nationwide, I wanted to give a brief background on our center. I have been asked many times over the course of the last few weeks with orientation and welcome events if Odeh Manan is someone's last name. when in fact it is not. The word Odeh Manan actually translates to this heart of ours in Potawatomi. The Potawatomi people are one of the original peoples of the Chicagoland area who know this as their ancestral home. They are part of the Three Fires Confederacy nations. I want to thank, give full credit, appreciation, and gratitude to Donald Perot, our friend, language expert, and elder who has been on this journey of creating this space since its inception. And he has provided all translations. We realize that in order to truly do good work for ourselves and for our communities, we must engage with our hearts and do this together. Hence the name of this space, this heart of ours. Although this is not a cultural center dedicated exclusively to Native and Indigenous people and their health, we are honored to have the opportunity to continue to partner with Native and Indigenous community leaders and healthcare providers to bring education, research, and practice to campus that centers the assets, deep connection, and collective well-being often present within these communities. This leads us to our Reclaiming Our Stories initiative that we are spotlighting today. Its goal is to help us recenter and renew the Odeh Center's 5 core commitments through various strategic avenues and storytelling that bring them to life through the eyes and voices of students, faculty, staff, and community partners. Trust is number 1, as nothing is possible without trust. Then we have our most central core value, as it is in the name, health equity. We move then to a term whose words I have already used multiple times today, and the main part of our conversation today, community care, as we have a deep responsibility to one another. We also have a commitment to ourselves in ensuring that we engage in constant self-reflection on how we can be better, a key component to cultural humility, our 4th commitment. And finally, we end with flourishing, the ultimate goal of this space. I want us all to hopefully be able to experience joy and peace here and always leave the center in a better mindset than when we came in. Today, we lean into each other by discussing the importance of community care in today's event, centering knowledge translation and health equity for empowered communities. And before we launched this initiative, I already knew who I wanted to discuss this topic. To know Dr. Floyd is to know that you will be seen, heard, and valued by her, and all members of her ever-growing community of students, colleagues, and external partners know that very well. Dr. Brenikki Floyd is the Associate Dean for Community Engagement and Director of the Collaboratory for Health Justice at the UIC School of Public Health. She is also a clinical assistant professor in the Division of Community Health Sciences and an affiliate faculty at the Center for Dissemination and Implementation Science in the Department of Medicine. Dr. Floyd has a diverse research agenda that includes health communication, implementation science, program planning and evaluation, intervention design using multiple methodologies, and community engagement. Her research and public health practice focus primarily on developing and applying health communication strategies within community and health system contexts to advance health equity and improve health outcomes, with a particular emphasis on underserved and historically underrepresented populations. Without further ado, Dr. Floyd. Share your slides. Can everyone see that online okay? The block here in the center will disappear in just a second. Awesome, thank you.
Hi, everyone. Thank you guys for coming out. Thank you, Adriana, for that lovely welcome and introduction. And thank you to the Odeh Center for inviting me. So I'm going to talk to you about health equity and communication and how we use that to care for community. My presentation is titled Centering Knowledge Translation and Health Equity for Empowering Communities. And so you're probably wondering, well, why exactly did Adriana choose me to speak to this topic? And so a little bit about my background. I have a degree in English, thought I was going to go to law school, became disenchanted with with law for a number of reasons. Then I decided to pursue communication because I stumbled upon it, honestly. But what I didn't know was that there was a concentration in communication that would pretty much, set the tone for my trajectory. And that was learning about health communication when I went to the University of Kentucky for my doctorate program. And I also have an MPH, which marries very well with my my PhD in health communication. Is it
I'm
not?
just making sure that we are saying like a
Some issue.
1 second. Sorry, everyone.
It wouldn't be a great presentation without some tech issues.
You know, you would think, okay, that should in theory disappear. Just make sure it does.
Okay.
Just keep going.
Okay. All right. Hopefully it'll go away. And so you might be thinking, well, what is health communication? All the things that you might imagine when it comes to communicating with a person, whether it's interpersonal communication or media. And I was super intrigued by communication because thinking about media as a whole, as a social structural construct, and how it has the absolute most strongest impact on how we think, how we act, what we buy. And so that really set the tone for me studying communication and applying it to the field of public health, which is where my scholarship lies. So what is knowledge translation? Before we dive into that, I just want to ask a quick question. What are some possible barriers to accessing evidence-based health information for most people in our community? And there's no right or wrong answer. Trust, excellent.
So the people online can hear you.
I'll say just like, there's just so many information out there, like being able to know what is like correct and what is not correct. Yeah.
Not being able to know what's credible, what's
Yeah,
correct,
yeah,
and not
yeah.
correct.
Yeah, credibility, basically, yeah.
You keep going.
Okay. All right. That's absolutely right.
We're fixing.
Yeah, hold on 1 second. We're fixing this.
Online, we don't know what resources to trust and as well as literacy levels.
Literacy levels, not knowing what to trust, exactly. So another thing I wanted to point out is that there's a knowledge gap. How many of you have heard of the digital divide? And how do you understand what that means? Anybody? What is the digital divide? Access? You want to add to that?
The digital divide definition.
Yes. Thank you for that.
So it needs to be kept in mind that digital divide does not always mean the same thing, and its evolution should be addressed in classes.
Exactly. So one of the things I want to thank you for that. What I want to add to that is, we know that annually, most scientific research is not accessible to the general public. And there are millions of articles published annually. It was kind of hard to nail down an exact figure, but from what I found in a recent study, well, not that recent, but in 2022, the number of studies that are published annually range between 3 and 5 million, depending on the source. And so part of that is, well, that's great, but a lot of that information is out of reach for most people who need it, And if it's out of reach, that's for a number of reasons. Could be cultural reasons, could be language issues, could be related to the information being behind a paywall. And so that's not very useful, right? And oftentimes the information that's available is published in a journal that's written for other academics. You know, there was a point in my studies where I was deciding if academia is really where I wanted to go, because in my doctoral program, we were just reading all these articles, learning about different interventions that were being developed, how they were being tested. And as most, you know, researchers would want to see, their interventions or their programs to address a health issue was efficacious, it was effective, it was doing what it was supposed to do. But my question at that time was, well, where are these interventions? Where are they in terms of being actually implemented in the community so people can benefit from them? I decided to continue on my program nonetheless. But you know, there's a lot of change has been happening over time. How many of you have ever accessed an article through open access? So you Googled it and like this research study just pops up, right? A lot of effort has been made over time to make sure that people can access information. And I think, you know, somehow, excuse me, the number of articles that tend to be maybe available open access range, you know, over 1 million or so, but there's still many, many more that are not. And so one of the things I wanted to point out was that our government, the Office of Science and Technology, implemented a policy where they require researchers who receive federal funding to do their research, they're required to make sure that that information is made available to you know, to the public, and also that data is readily available too. But mainly that sits in places like libraries, like where we are today, in journals and things of that sort, where people oftentimes can't get them. And so you might be wondering, well, how is health equity connected? You might be thinking, okay, I can see where you're building up to this. Just for the sake of, you know, everyone who's joining us today, I'm going to, define health equity. But so if you already know the definition, just, you know, bear with me. Health equity is described as a condition when all people can reach their full health potential and they're not disadvantaged from attaining their full health potential because of their race, ethnicity, gender, social, economic class, sexual orientation, basically for who they are, right? So people have the opportunity to be their healthiest self. I have always seen access to health information as a social determinant of health, the way in which we think about social determinants of health. So for the folks in the room and online, what are social determinants of health? Do you all know what those are, or some examples? Throw some out there. Social determinant of health.
Racism.
Racism, right. Yep, cannot be denied health, optimal health because of race. In the back.
Built environment and structures put in place around the built environment.
Structures built in place around the built environment.
People feel free to participate in the chat as well.
Access to healthy foods, access to health care, you know, we access to quality education, you know, employment opportunity, economic opportunities. We think about those things, but we don't really think about how access to information is just as important as a health determinant as well. And so thinking about that, you know, there's some things to think about more deeply, like health literacy, right? You give people access to information, but what if they don't understand it, right? Or what if there's information out there, but people don't know how to navigate that information? Or what if the information is out there, but it's presented in such a way that they can't apply it in real time to their lives, right? And so these are things that we have to be mindful of, because most communities will resist any information that's not deemed as credible, not deemed relevant or applicable. So I think one of the things that really solidified my understanding of presenting health information as a social determinant was a social marketing campaign that I worked on with the Illinois Department of Public Health. How many of y'all have heard of the Illinois Breast and Cervical Cancer Program? Anybody? One person? Okay. What about the Illinois Wise Women Program? Anybody heard of that? Well, a quick shout out to the Illinois Department of Public Health, the Office of Women's Health and Family Services. Um, the Illinois Breast and Cervical Cancer Program is a program that provides folks with free access to breast and cervical cancer screening, right? Free of charge. And if they do have insurance, they'll help you if you have a high deductible. So their goal is to make sure that people who are uninsured or underinsured have access to services that can be life or death changing. And then the Wise Woman, I consider this a sister program to the Illinois Breast and Cervical Cancer Program because it's focused on reducing cardiovascular disease and getting people access or linked to services to reduce risk for cardiovascular disease. Well, one of the reasons why I was asked to be a part of helping them to rebrand these programs and develop a social marketing campaign was because they realized that people weren't aware that they were receiving services from these programs. And the reason that is because there's not a brick and mortar for the programs. So they partner with health departments, they partner with private doctor offices. And so a person go in there and get their service, they have no idea that there's a connection to this program, which means that they don't know that they could, there's a missed opportunity to tell their friends and families about, this program. And so the thing that I loved most about that work was the goal was to not just rebrand, because some of their marketing materials were dated and it was time, but it was an opportunity to raise awareness about two programs that could change folks' lives that people did not know about. One of the things I really appreciated with the work with IDPH was that they also wanted to make sure that a wide range of audiences were aware of this program. So, you think about breast and cervical cancer, you think about Wise Woman in the name, you think women, but they wanted to make sure that different audiences, whether they were people living in rural areas, older people and younger people, people who identify as LGBTQ, they wanted everyone to be aware of these programs. And so I really enjoyed the work with IDPH, but I wanted to sort of set the tone for you to understand why I see access to health information as a social determinant of health. There are some people who, by simply knowing that this program existed and was able to be a part of it, were able to get the support that they need and the services that they need. And so knowledge itself is power is a quote that I've come across many times. What's flawed about this quote though? Do y'all agree that knowledge is power? We're saying that people need access to information, particularly health information in this context. What's wrong with this particular quote? We see this quote very often. Knowledge is power. What's flawed with here? Uh-oh.
We have someone in the chat that says access is power.
Access is power. Yes. Access is power. Thank you, Laura. Thanks to the folks in the chat. What's flawed with this quote? Oh, I see what's happening. Mm-hmm. Yep.
Oh, 1 second.
What's more important is how you use the knowledge. Like just to
Mhm.
have it and not use it, it could be a completely different thing.
Yep. And to build on what you just said, also understanding that knowledge. This quote implies that you have access to the information, you're going to automatically know and understand that information. And if you don't understand it, then you're not able to apply it the way in which you just described. Thanks for that.
Yeah, we've got a couple in the chat. You need to understand what you're reading or understand the knowledge you're getting. And
Mhm.
knowledge without ability or access won't create any change.
That's exactly right. Thank you for that. And so that brings me to talking about a bit about health literacy. Now, I'm not going to talk a lot about health literacy because some of these topics really could, fill a semester long course, actually. So just to kind of hit some of the high notes, health literacy, you can think of it in a number of ways: personal literacy, numeracy. But I personally wanted to point out personal health literacy and organizational literacy. Personal health literacy is the extent to which a person is able to access and understand and use the health information and services like we're talking about But then there's also organizational health literacy, which is putting a responsibility on an organization to make sure that people can have easy access to the information that they use. And I wanted to point that out just because of the connection with the effort that IDPH set forth. Why is health literacy important? It's connected to a number of issues that in public health we're aiming to prevent. So for example, patients with low health literacy may have, increased visits to emergency room, excuse me. They may have longer hospital stays or more hospital stays. They may have higher mortality rates. They may have difficulty following treatment plans or being adherent to treatment plans for them. And so who's at risk for health literacy? People who look like me, honestly, Black and brown people, people who are older, immigrants, people who are new to our country, people who may have disabilities or, low income. There are a number of reasons. And so basically, it could be any of us in this room. And, just because I might have a PhD does not mean that I'm not susceptible to health literacy, right? I don't understand all the jargon that my doctors are saying when I go to the doctor's office. And so in addition to health literacy, I want to point out media literacy. How many of you all get health information online? Yeah, how do you know if that information is credible? Let me ask
Great
this.
question.
Yeah, right? Vivek?
I mean, for me personally, what I do, I usually check on either the Cochrane review to see whether like it's I look at journal articles about a certain topic to just make sure that whatever I'm getting from the media is correct. But I do know, for example, my mom, she gets a lot of information on WhatsApp, and sometimes a lot of them are not correct. And then she comes back to me, and then I'll tell her, Mom, this is not correct, or this is correct, right? So, I mean, just it depends based on like how I double check the information might not be the same way that my mom, for example, won't. Yeah.
Mm-hmm. Yep, thanks for that. Looks
We've
like
got-
there's some comments in the chat.
Yeah, some comments in the chat.
AI is tricking everyone these days. You don't anymore, especially with the rise of AI created videos. It's
Mhm.
super scary because they're getting really good. If I find a medical journal or publication with an article, I check the reference they use.
Mm-hmm. Yep, that's great. And I appreciate you mentioning AI because that's now another another tool that we have to be mindful of. And so yeah, that's all correct. I think that, having this access to all this information sometimes can be an overload, and sometimes people may not take time to fact check. I remember when I was working on the social marketing campaign, I did focus groups with the different audience segments. So I did one with older women. I did them with Asian American women, Black and African American women, Hispanic women, so forth and so on, LGBT women. And it was during that data collection that I learned about WhatsApp and how much misinformation is shared on that app. It was particularly in the focus group with the Asian Americans, where they talked about how one young lady was talking about her grandmother and how she uses WhatsApp to communicate with people here, but also back home in China. And she was just, concerned with all the misinformation that they were sharing amongst themselves about health conditions and remedies and treatments and things like that. And so that just really spotlights that you have to be very mindful of. We may have access to information, but is it credible? Is it reliable? And so just to sort of ease into media literacy, it's basically what health literacy is about, but it's being able to use multiple forms of media and recognize the credibility and recognize biases and so forth. Being able to evaluate health information, especially when we're gathering information from social media and so forth.
I'm just going to share a paragraph that was sent in the chat
Yeah.
regarding low literacy and its strain on individuals and the healthcare system. One of the leading resources for unnecessary ER visits is pediatric night fever. If training on child illness management was to be readily available, unneeded ER visits could be prevented.
Mm-hmm. Yep, I didn't even go into the whole, cost, cost benefit analysis that people, apply to this when it comes to accessing the ED. So thanks for that. And so I've already asked this question, but I want you to think about also a time when, you learned about some scientific findings through the news or social media, and, not only how accurate was it, but how accessible was that? You don't have to answer that question now. And so we all went through COVID together, and that is a good example of the amount of misinformation that we encountered. I think for many people, that was the first time that this notion of misinformation sort of came about when we were, actually going through an infodemic while we were going through an pandemic with all the information that we were being exposed to. And it was very difficult to sort of figure out what was accurate and what wasn't. Can you all name a time when you got information during COVID that you thought was going to be really helpful and it turned out to not be? Were there any examples that you all want to share? What did that look like? What about any information that you're getting now in this current social political climate that you've gotten and it turned out to not be accurate information? You can keep that to yourself, actually. Oh, go for it.
I was just going to bring up the total amount of information being put out there around vaccinations in general, autism, yada, yada. I think more specifically to COVID, I think in the current moment, I think there's a lot of uncertainty around like who has access to vaccines. Am I eligible? Are my kids eligible? So I think even people that are educated are asking themselves a lot of questions. And I think that can also trickle down. If you ask your physician, what am I supposed to do? And they don't have a great answer, I think that can, create some uncertainty.
Yep, it sure can.
Going back to COVID, I think a lot of that came from like one-on-one conversations with people where, for example, I remember being in just a talk with someone from church, and like they were talking about, oh, I took ivermectin, and I didn't really know what to say to that. But anyway, he's like, oh, it really, really works. And I've also heard that with other friends of mine who will be like, oh no, don't take that vaccine, blah, blah, blah. And then they'll send me a text maybe later with some link to something online about that vaccine, especially the COVID vaccines. So I do find it's not necessarily even just like online, but it's like the personal interaction with people.
Yeah.
And then you have that, oh, well, let me back it up with some quote unquote link to something online as if that was like scientific proof.
Yeah, no, I appreciate that. Thanks for that. You want to add to that?
Maybe not.
Okay.
Old at credibility, like that whole deal and stance from a person who, I have a PhD and I'm like, I'm good at it, at least finding the close to the right answer as possible, right? That's my training, where we come around family members goes way more than you. That health literacy part baffles me. Like, okay, I appreciate your lived experience and I appreciate how you found this information, but can I give you an alternative to think about? And sometimes that's hard to, and I'm interested in and into you navigate those, informing individuals correctly, especially like the holiday coming around. Of course,
yeah,
I'm interested to hear from you.
Yeah, just so to answer that really quickly, it is difficult. My first, step is to always try to meet people where they are. I try to listen. My brain works in a like a root cause, a root cause analysis type way. So I want to understand why they think what they think, or why they behave the way they may behave. And I try to meet them where they are and share the information in a way that with an attempt to get them to understand it. right? Because a lot of what they may hear in the news, even on social media, can be very technical and academic. Um, so that's one thing. The other thing is like sometimes there are cultural practices that are part of that contribute to the barrier. Like this is just how it is, or you know, and that sometimes is really difficult. And the best you can do is share the information and be consistent in your messaging. You know, I wish I had a for sure like this is what you do. This is how you fix your family. No, it's difficult. You know, because people they hold really tightly their beliefs and their own lived experiences. But I also want to double back to something you mentioned too, is that I do think folks' lived experiences are very important. And I think sometimes helping them to um, to see their lived experience through maybe examples or storytelling. It may not move the needle, but maybe it's just sharing or exposing them to more information as it relates to their lived experience. So that's not always easy to do, but that's a really great question. And that's why people continue doing this work, trying to answer that question.
Wanting to just engage some of the folks online. Thank you so much
Yeah.
for participating. Celebrities were spreading misinformation too about the vaccines, not just COVID, the whole quote, vaccines cause autism mess. As far as now, there was a lot of misinformation about resources given to migrants last summer. There's a lot of misinformation now about SNAP qualifications. I also think about the speed of misinformation during COVID. Someone could make an incorrect statement and it would spread like wildfire. But when the corrected information is shared, it didn't get spread half as fast. The damage is already done.
Mm-hmm.
There's more, so thank you. Keep participating online, everyone. I appreciate it.
Yeah, I appreciate that comment. And it reminds me of, something I was thinking about what a previous comment was made about. Sometimes the messenger is, someone that, or a messenger you think is credible, but turns out they're sharing incorrect information. Like you gave the example about the CDC and the vaccines. And then, we're looking to our government to talk about these policy changes. And quite frankly, I'm baffled by how much information, incorrect information is shared by our government. Right. So what do you do in that moment? Like, seriously, I'm asking you all for help. you know? Yeah, that's a hard one. I do believe there's truth in patterns. And so I look for information, look for multiple sources, look for consistency. Um, but I often go on a media diet quite often. So I might be behind times. But yeah, what do you do? Salacious information tends to spread faster than facts, right? Especially when we're talking about, so this is a good segue into disinformation, because a lot of times what is shared, if it's intentionally wrong, is referred to as disinformation, using information to share biases or, create some manipulative narrative to, perpetuate or support some hidden agenda, propaganda. I think it was the last 2 administrations ago where I learned the term fake news. And it seemed like, oh my gosh, we were being primed for that now, right? And so, being able to identify that false information, disinformation is part of media literacy and why it's so important. So I'm just going to briefly go through some slides and let you kind of just observe or look at some of the things on the slide. But these are some examples of messages that were shared during COVID that some people really took to be facts. We don't yet know some of the long-term effects that some of the mis and disinformation that's had on people who, followed some of the recommendations and suggestions that they may have heard. Again, I'm just going to let you guys sort of look at some of the examples there. And so this is why knowledge translation matters. I don't know how many of you have heard of the term knowledge translation prior to now. No? Good. So I can tell you about it. I learned about knowledge translation when I was learning about health literacy and learning about implementation science. It's actually a term that's coined by the Canadian Institutes of Health Research. They do a lot of health equity and knowledge translation work, and it really does align with the way that I see the world and how I go about doing research. So it's defined as a dynamic and iterative process that includes the synthesis, dissemination, exchange, and ethically sound application of knowledge to improve health, provide more effective health services and products, and strengthen the healthcare system. Sorry, that's a typo. The goal really is to close the knowledge gap. And the focus really is about moving from just sharing knowledge or disseminating knowledge to actual use of that knowledge, which goes back to why understanding that information is so critical. What you see at the bottom are just some other terms that have been used when talking about knowledge translation. Sometimes they're used interchangeably. And there are four elements of knowledge translation. I'm really going to focus on dissemination, but just really quickly, synthesis is pretty much self-explanatory. It really is about summarizing scientific findings and disseminating it. And so outputs might look like a meta-analysis or a policy brief, as an example. Then there's dissemination, which I'm not going to talk a lot about that because I got several slides about that. But it's self-explanatory, right? Sharing information. Exchange is focused on the exchange between the person who's going to use the knowledge and the researcher, right? I don't know if any of you have heard of CBPR. Why am I drawing a blank? Community-based participatory research, right? Or community-engaged research, right? This starts to lean into that space. I'm going to talk a bit more about that too. And then ethically sound application is really thinking about like what are some of the norms and laws, regulations that compete with the interaction between the user and the researcher. And so one of the things that I think is really useful to know about knowledge translation is that it is really a collaborative approach. It truly emphasizes the need to make sure that the person who's using the information is part of the process. And that applies to all four elements, but I don't have time to go through all of them. So thinking about this a bit deeper, I just want to share two things. For people who are doing research, and when I put together this slide, I was really trying to give everybody a little bit of something. So for people who are doing research, for our community partners, so I'm all over the place, it seems, but it's intentional, so I'm trying to reach a lot of people. But for people who are doing research, how many of you do research as part of your job? And how many of you plan to like go for grants to either support your research or support your programming? Yep, cool. So knowledge translation tends to show up in two ways. One could be what's called end of grant knowledge translation. And that's really at the grant writing phase of it, where you include like a dissemination plan, how you're going to share the information, to which audience. And oftentimes that looks like going to conferences or writing journals. But then there's the integrated knowledge translation approach, also, supported by the Canadian Institutes for Health, where they emphasize this collaborative approach I was telling you about, this co-learning approach, co-production approach, right? There's a new body of research. I don't know how new exactly, but I would say it's emerging in many ways of this co-production in healthcare. And I'm just now tapping into that body of work, but it kind of builds on the notion of, shared decision making and making sure that patients have the information that they need to be able to actively participate in their healthcare. We are moving away, as we get older, from the days of just believing our doctors. Whatever our doctors say goes. Many of maybe our grandparents, still think that way. But society is changing and we actually need to be more actively engaged. I did some focus groups over the summer. This was a project to understand how medical providers, clinical care team members use health literacy interventions when interacting with their patients. And I wanted to know, well, what do you do? What does that look like? So we interviewed some doctors and nurses, but we also interviewed community members to understand from their perspective, what does that look like on as the patient end of it? And one of the things that really stood out in that conversation for one of the interviews that I did was one woman talked about how hard she advocates for herself, like how critical that is for her to be able to get the care that she needs and at the level that satisfies her needs. She just can't go in and show up though. You know, she talked about having to advocate and having to um, basically make sure that she's included in the conversation. The thing that resonated most was that this wasn't a welcome invitation though, right? The doctors didn't say, you know, please be a part of this process. What do you think? You know, but she had to, and this did not look like one visit either. This was going to the doctor telling her, you know, this is what it is. It's not a big deal. Go to sleep, drink your water, you know, that kind of thing. I'm being funny, but you know, and her like, no, something's wrong, you know, and coming back and saying something's not right. And so advocating, I nice little tangent, but the shared decision making piece is really important. And what integrated knowledge translation does, which is also what community based participatory research does, or community engaged research, it addresses power differentials. You know, and in public health, when we're thinking about healthcare and patients interacting with their providers, you know, power differentials is a big issue and can be a barrier for people actively engaging in their healthcare and be a co-participant in that process. So I know I'm winding down on time, so I just want to say dissemination is where I wanted to spend a bit more time, because it's really that space where when we're trying to communicate with our community partners and our students and, you know, healthcare providers, you know, making sure that we meet people where they are and giving them the information that they need, the messages that are tailored to them is super, super important. I'm going to skip ahead a bit. So I talked about the CBPR approach, right? How many of you have heard of this approach before? Have you actually been engaged in it? Yeah, what did that look like?
As a researcher, for me, it's always reflective. So that's just my biggest thing. It's
Yeah.
always reflective for me.
Yeah.
So situating myself, taking away my biases or acknowledging my biases or positionality, being reflective and being present in the moment. But do you want an example of what that looked like?
No, that's good.
Okay.
That's good. Like your experience is good hearing that.
Thank you, Dr. Burton. Other thoughts? Yes.
Yeah, I've also used it while I was a student, a graduate student, but also right now working with Dr. Burton. But then I was involved in the process where we actually were putting together a CPPR project with community, but it was mostly focused on food system, access to healthy food.
Oh, great.
So we're actually like engaging community members to like do like a need assessment. But also in my own research, I've also done some community engagement by using like Black feminist thought. So that's the framework that I usually use for my research. Yeah.
Oh, that sounds great. I think the key thing that I want to bring to this conversation is, you know, my focus with this talk was to, you know, integrate get us to start thinking about how to empower, how to give our communities the information that they need, because they're already empowered, right? We're not necessarily trying to empower them, right? Our communities are experts in their own right. You know, we as academics are mindful of not coming down in the ivory tower, so to speak. I really love using that example, like coming down the ivory tower and telling community what they need best. How crazy is that, right? They know what's best for them. They know what their communities need, right? At the School of Public Health right now, we're holding an event that we're calling Community Voices. And we're inviting community organizations to have a conversation with us to learn what are their needs as an organization and what do their clients need, so that we can figure out collectively how can we help them. Our hope is to develop a community-driven research agenda But then also, what else can we do? Perhaps we can set up internships or community service, right? Because many organizations are having capacity issues. They're dealing with a lot in the community right now, right? We want to hear from them to know what's going on because they they live it every day, or they're working in these communities that need this help. Um, and so trusted messengers on the screen here. I don't really want to go into all of it because I don't have a whole lot of time. I want to make sure that Yen has time to share out what she's captured. But the takeaway is that there's a great deal of information that's made available to everybody in theory, but truly not, right? We have open access journals, yes. But even if you access those journals by doing a Google search, it's not necessarily mean that you're going to understand what that means. Actually, it doesn't even really mean that you're going to be able to open it if you don't have Adobe on your phone. You know what I'm saying? Like, there are these things that we take for granted sometimes in academia. And so as researchers, the onus is on us to make sure that we're giving our community members an opportunity to be a part of the process of co-creating the health information so that they understand it, right? If we do a study, conduct a study, they should be a part of creating what the output is going to be, right? Whether it's an infographic or maybe you have a street outreach team going out in the community and sharing information. This is just a quick shout out to a COVID street outreach team that I worked with during COVID, where we went out and gave the community health information about COVID at the time. And then when the vaccine became available, we were giving them information about the vaccine because people did not know where to go. Some people didn't know how to access the online appointment portals and things of that sort, right? And so that's just a shout out to the team and the work that they did over probably over a year. And here are some of the things that we were hearing from the community, when we were engaging them. People weren't about that vaccine, you know, they weren't. And so my team had to meet them where they were and give them information to say, not pushing you to do anything, but here's the information as we know it, scientifically based. So I think I'm gonna stop there just for the sake of time. I'm here to answer questions though. Yeah.
Absolutely. No, thank you so much, Dr. Floyd. And we've got some time for Q&A. So questions here in person and in the chat. Well, again, we want to make sure that we have some time to show what Yen's been creating for us so you all can see that. And hopefully some of you that are still here, that were here earlier today, have been doing some sketching and practicing some of the skills that Yen taught us all earlier. Any questions? All right, 1 second.
Thank you so much, Dr. Flo. This was very informative. I have a question about like culture, right? Sometimes culture, even moral, people's moral foundations. Because sometimes like when, let's say, for example, I'm trying to talk to like a friend or somebody in my community who doesn't believe in like vaccines for her or for her children, and then they have like different like moral foundation or cultural perspective, right? So how is it like in your own experience, right? How can you frame it, right? For example, like the slide you showed earlier where people spoke about like the vaccine was like a mark of the beast or etc. So like how would you frame it to change their mind? I don't know if changing their mind, but to be more acceptable about like vaccines, for example.
Yeah, that's a good question. And that's actually a tall order to do. Can you imagine someone changing, one of your cultural beliefs? A stranger, in fact, or even a family member. That would be very difficult to do. I think the best you can do is to give them the accurate information as you know it. If you can make a parallel to that cultural practice, because sometimes holistic care, holistic practices can complement Western practices. Not always, but in some instances that they can. And in those instances, making the parallel could be helpful. Sometimes it may be helpful to have someone from that person's culture who may have the knowledge of like the evidence-based knowledge, have them talk to them. You know, like I use the example all the time that, you know, I do a lot of work on the south and west side of Chicago, but I'm actually from Mobile, Alabama, right? So I'm like a insider outsider, so to speak. I've been living here like over 12 years, but I recognize that Chicagoans are Chicagoans, you know? And even though there's some cultural relevance, right? I'm from the South, the deep South at that. So sometimes maybe, you know, having someone from their culture speak with them, you know, they can talk to them in the ways that we may not be able to. I know that wasn't a perfect answer, but I hope that helps.
Thank you, Dr. Floyd. I have another question here.
Actually, I just wanted to add to that question because so there's a really good book called Think Again by Adam Grant. And he talks about that when we're trying to communicate with people, especially when it's like a polarized issue, that we want to get our point across, but forgetting that we really need to learn more about like what you were saying, like how your brain operates, like problem solution, right?
Yeah.
So asking more questions versus like coming in and be like, this is what you got to do to live.
Right.
But instead asking questions like, what are your fears? Like, what is it that makes you feel uncomfortable about getting the shot? And what did you hear? And how did that make you feel? So that you can really get to understand the point of view that you need to come in, because sometimes we come in and we just know exactly what we want to say. And the reality is like, well, that's not really my issue. My issue is that, you know, I have thin blood or whatever. you know.
Right, right. And also I think creating space to be heard, that helps with building trust. And that also sort of breaks down any walls or barriers that people may throw up to where they may even be open or willing to just hear you out, you know, or consider what you're saying. Just to add that.
Another question here.
Hi, Dr. Floyd. So kind of thinking about trust, because that was kind of the word I was looking for. And this is largely from like that ivory tower perspective, like as a current grad student, thinking about like how the field of public health is being in some ways dismantled, in other ways transformed. Like, what does it look like for us in both the research setting or in practice to like actually rebuild some of the trust that's been eroded, both since the pandemic, but even now, some of the institutions that we as researchers used to go to, like it used to be like, oh, go check the CDC. And now it's like, can we check the CDC? Right. So like we have kind of these two different divergences of trust where like we're still trying to communicate to the community, but we've also lost some of our own foundations. So what does it look like within like the context of knowledge translation, kind of moving forward in our field?
Yeah, no, it's a great question, Janae. You know, I'm thinking about a trauma-informed approach. I've been thinking about trauma-informed approaches a lot lately. And I think one of the principles of a trauma-informed approach is to name the problem and acknowledge the problem. Recognize the root cause of the problem. And I think that we don't do that enough. And I think that, you know, that might seem a very simple answer, but I think it goes a long way. You know, when I am engaging community or I'm talking to new students about, you know, working in community, I always acknowledge the harm that UIC has caused in our communities. And that the onus is on us to present ourselves in such a way that we are working toward repair and recovery and being empathetic, having empathy, you know? So that's what I'll offer you for now. I'll think more about it and let you know if I think of anything else.
I think one thing to add, Dr. Floyd, just on the heels of that, of something that's very, very, very simple, but goes a long way in really any kind of dialogue of feedback that was shared with me that I've really held, is that when you're having a conversation with someone, just because you don't agree with them, you can still say thank you. Right. And I think that that's something that, again, very, very simple and seems very obvious, but I want to highlight because having a conversation with someone where your first reaction to after they give their perspective, it's like, well, I think you're wrong because it's like, thanks for sharing that. Even and saying thank you, they could be saying the most absurd, abuse, like horrible things. And you saying thank you isn't you agreeing, but it's like, I always kind of thought you were problematic. Thank you for proving my point. Thank you, right? Or it can be, thank you. That's, I don't agree necessarily, but I can better understand where this is coming from
Yes.
or something, right? So I think that regardless of your stance on what someone is saying, being able to just say thank you
Yeah.
is like, that doesn't mean you agree. It's just like, thank you for sharing that, and now we can continue the dialogue or not, depending on the situation.
Yes, that makes me think about, showing up in your authentic self while being respectful. I can say, thank you for sharing that. I actually don't agree with you, but I hear you, so thanks for adding that, Adriana.
I think we have one more comment, and then we can go to Yen.
Yes.
So, hi.
Hi there.
Thank you so much. Yeah, I think it's really, especially really hard with family members and like when you're on the other side of the debate.
Yeah.
So I think avoidance happens a lot. And then it's also like, well, no one really wants to be told they're wrong and that you're right. And I think that's the ego part really comes in so strong. And I think that's why that's a huge barrier to communication is like the ego. I'm like, oh, well, I'm right and you're wrong. And I'm going to tell you that. So one thing I found is actually kind of funny is using humor. And so like I have a friend who's like really wise, and she knows a lot about health. And then we'll be talking and then she says, oh, vaccines have nanoparticles in them. And I'm like, and then I'll be like, oh, well, that's your conspiracy theorist side. And then I'll start joking with her about it. So it's kind of, it's just a lighter way of doing it, but
Humor.
you have to have a relationship with someone that you can do that with, where it's not like you're beating them over over the head with some facts.
Right.
Because you're going to always debate facts and, oh, here's some videos online to verify my point of view. So
Right.
humor is pretty good.
Humor is great. And one thing I didn't say earlier, I didn't really get to emphasize. I hope you guys were sort of glancing at the slides as I kind of went through them briefly, but understanding your audience is super important. And when I mentioned meet people where they are, understanding who you're talking to is part of that process. And so knowing that humor may work for certain people, may not work for others, and being straight up and blunt may work for some people versus others. And so thinking about just different ways to communicate with people, but also different ways to share information, hence this slide. Shout out to Community Health Sciences Division. We have our podcast called Community Level, led by Dr. Kelechi Ibe Lamberts. But campaigns, using video games, using infographics, like there are different ways to kind of reach people. Humor, adding humor, I like that approach too.
Thank you all so much. I'm going to pass it on to Yen briefly to be able to share some of the graphic recording and illustrations she was able to make over the course of the last hour. So let me unshare over there and then you can share.
I'm looking forward to seeing this.
And everyone, please, please, please help me in thanking Dr. Floyd for being here. All right, Yen, all yours. Great.
Just for accessibility's sake, I went through and listened to Dr. Floyd and to highlight that health communication is various in strategy. There's a person on the side of a valley with the benefits on the other side, and in between is the knowledge gap. She talked about the social determinants of health and how having access and understanding contributes to that. Oh, it went so quickly, excuse me.
You can play it again.
Let me pull up. There we go. and the social determinants of health, and how the happening of COVID brought on an onslaught of misinformation, disinformation, and this infodemic, fake news, that health literacy and media literacy means looking at sources, asking credible people. She mentioned knowledge translation that needs to be dynamic and iterative, and that health equity is when all people can reach their full health potential, and strengths that we can look at in the community, collaborations, and advocating for self. Thank you.
Thank you so much, Yen. Again, please join me in thanking both Yen and Dr. Floyd for their presentations today. Thank you all so much for being here in person. And I have a shout out for our event. Let me just grab my notes really quick. In the meantime, I'm also going to put up online for everyone here and everyone on the chat. I'm gonna share some QR codes for the event that's coming up, for our newsletter, if you're not already receiving our newsletter, and for an anonymous feedback form on today's talk. If I grab my notes, I'll be able to share a little bit more about the event. So again, thank you all so much for being here. Miigwech, that is one way to express thank you in Potawatomi. It expresses a desire to reciprocate in the future. Miigwech to Yen Azzaro and to Dr. Brenikki Floyd. Miigwech to the Odeh Center team of Cassandra, Samina, Makeda, Bayan, and Aaron, and our Office of Vice Chancellor for Health Affair partners, Michael and Brian. And miigwech to all of you, both in person and online. We hope you're able to join us as we continue our journey on spotlighting all 5 of our core commitments. Next month, we will spotlight cultural humility, and we'll be hosting a wonderful panel of UIC faculty, staff, and community partners, including Dr. Daisy Diaz Strong from the UIC Jane Addams College of Social Work, Dr. Mansha Mirza from the UIC College of Applied Health Sciences, Elizabeth Cervantes from the Southwest Suburban Immigrant Project, and Crystal Stevenson from the UIC Auburn Gresham Neighborhood Center. This will take place on Friday, November 21st at noon, and will be an in-person only event. We will also be partnering with the College of Pharmacy's Atkins Medicinal Plant Garden and the UIC Heritage Garden to make homegrown teas as we engage in dialogue together. So please register. It will be very needed come November. Please scan the various QR codes on the screen to sign up for that event, our newsletter, and provide anonymous feedback on today's program. And Bama Pimain, or until another time in Potawatomi, as there is no word for farewell, and we expect to see each other again soon. Thank you so much.